Hi everyone, and thank you very much for coming to this virtual open event for the BSc Occupational Therapy. I'll just start by introducing myself, and I've also got my colleague Rachel here. My name's Sarah, and I am the admissions tutor for occupational therapy, and I'm also one of the senior lecturers on the programme. And Rachel, if you just want to introduce yourself, say hi.
Yes, hi everyone. Hopefully you can hear me okay. I'm Rachel, I'm one of the senior lecturers as well in the BSc programme and also the deputy course director. So it's really nice to have you all here this evening.
I have to say, I really wish I could see you. I find it quite scary, actually, talking to an audience where I can't see you. But there is a chat on the right of the screen, and you're really welcome to put any questions you have, or if you want to just say hi in the chat, we'd love that. We have also got one of the third year OT students, Marie, here, but I think I was going to invite Marie to say hi as well, but I know Marie's having some technical problems, which is often the case when we do things virtually. But if you do have any questions, I know Marie will be able to answer in the chat. So I've got a PowerPoint presentation, so I'm going to attempt to share my screen now, and hopefully that will work. And then we will make sure that we have time for questions at the end. I think we have until 5 to 5 for this slot, until we all get kicked off the slot and have to go into the chat room. So I'm going to keep a close eye on time and try not to talk too much, which I'm not very good at. So just to make sure that there is time to answer any questions you may have at the end. But please do, feel free to pop them in the chat as they come up. Okay, I'm just going to share my slides, Rachel. Okay, I'm hoping you can see that. Okay. I can't see you or anything, so I'm hoping, Rachel, you can indicate to me if for some reason you can't see this, but as far as I can tell, you should be able to see this. So I'm going to be talking about the BSc OT program at St. George's. So I'll talk a little bit about occupational therapy as a career, because usually at this open day, there are, you kind of might be deciding which course you might like to apply to. I'm going to talk a little bit about the occupational therapy program at St. George's, and then I'll talk a little bit about the admissions process if you're wanting to apply for occupational therapy, and a bit about the entry requirements. I can't actually see the chat. When I share the screen, I'm not able to see that, but I think Rachel will keep an eye on the chat, and like I say, any questions that we don't get to, we will come to at the end. Okay, so occupational therapy is a career centered on people. Sorry, I'm just going to try and switch off this very annoying maybe I won't. Sorry, I'm sorry about the beeping. So occupational therapy is a career centered on people. So if you just think about how you would answer this question for yourself, Are you a creative problem solver who enjoys helping people to get the most out of life? If the answer to that is yes, then occupational therapy might be a really rewarding career for you. So I'm going to talk really briefly about what is meant by occupation. So occupation really is the everyday activities that are important to people, the things that people do in their everyday life that bring meaning and purpose to their life. So that includes things like people's self-care, so things like getting dressed, eating, toileting, grooming. Work that might be productive work, or it might be like schoolwork or nursery work for children, and leisure activities are the things that people do for fun and enjoyment. So when we talk about occupations, we mean those everyday activities that people do. So that's quite a wordy definition of occupational therapy, but it's about providing practical support. So it's a very practical, hands-on profession to help people do those daily activities that are most important to them. So the things that really matter to them. So it's really about increasing people's independence and increasing their quality of life, increasing their health and well-being through occupation. So it takes a really whole person approach. It's a very holistic approach to health and well-being. So it really looks at people's physical and their mental health and well-being to enable people to achieve their full potential. So what it is, it's a really person-centered profession. So the person is always at the center of what we do as occupational therapists. It's concerned with promoting health and well-being through occupation, so promoting people's physical and mental health and well-being through occupation, enabling people to do those daily activities that really matter most to them. And to do that, we might work with people individually, like one-to-one, or we might work with groups or communities or populations of people. This little quote here, I think, really captures a lot of the essence of occupational therapy. So occupational therapy practitioners ask what matters to you, not what's the matter with you. So it's a really strength-based and person-centered profession. So occupational therapists work with people with a very wide range of people. So anybody who is having difficulties with doing daily activities may benefit from occupational therapy. So that's a really diverse group of people. And we, as an occupational therapy profession, we are really committed to attracting people from all walks of life, from all different backgrounds, which is really needed to meet the diverse needs of people who need support from occupational therapists. So when might someone need an occupational therapist? Well, when there are problems with everyday occupations, and that might be because of a whole range of different reasons. It might be because the person has a physical illness or disability, like maybe they've had a stroke or they've had a car accident, or they have a diagnosis like cerebral palsy, or it might be because of a mental health illness or disability. It might be related to getting older or a change in the person's living circumstances or lack of opportunities to do daily occupations. So it's a real broad range of people. Where occupational therapists work, so occupational therapists work in many different diverse settings. They might work in hospitals, so like acute hospitals for people with physical needs or mental health needs. They may work in private practice, in social care, so like in people's homes or in care homes. They might go out and work in schools with children or nurseries. There are lots of kind of exciting role emerging areas of occupational therapy, which are newer areas of practice, like working in prison services, working with refugees and disaster survivors. So, and you would be qualified to work in all these different diverse settings when you finish the BSc and qualify as an occupational therapist. So what do occupational therapists do? So occupational therapists, as I've said, work with people of all different ages and backgrounds, right the way through from their occupational therapists who will work with preterm babies and young children, all the way through to older adults and end-of-life care when everyday activities are difficult or challenging, and that might be because of a whole range of different reasons. They will work with communities, groups, individuals, and commissioners, and locally, nationally, and internationally. So how do occupational therapists help people? I'm not going to talk about this really in any detail, because this is really what a lot of your modules in the course will be about learning. But essentially, it's about identifying what that person's skills and strengths and abilities and interests are, and what it is that they want or need to be able to do. What are their roles and routines? And then really to do an assessment of that person's needs, to set goals together with the service user, and to plan treatments with them. And there are a whole range of different interventions or treatments to enable people to do the activities that matter to them. And a lot of the course is really around teaching you how to what those interventions are, and how to facilitate people to do their daily occupations. So why become an occupational therapist? Well, these are just some of the reasons given by the professional body, the Royal College of Occupational Therapy. So you will be able to help people to do what matters most to them, to engage in those daily occupations that are really important to them. It's the only profession that uses occupation as a therapeutic tool to promote people's mental and physical health and well-being. You can work in very diverse settings, like the ones we've just been talking about, with very diverse groups of people. You really do have excellent career prospects as occupational therapists. There is a national shortage of occupational therapists, and if you look at NHS jobs, you'll see how there's such a need for occupational therapists in the UK. So I'm going to talk now about, I'm just looking at time, I'm doing okay for time, because I wanted to give myself time to talk about why St George's specifically, because you could study occupational therapy at various different universities in the UK. So I'm going to talk a bit about what maybe makes St George's a bit different. St George's is the UK's specialist health university. So all of the courses at St George's are healthcare courses. So in that sense, everybody who's chosen to study at St George's is like-minded in the sense that everybody's chosen a course that's about promoting people's health and well-being, in that it's a healthcare course. The campus is on the site of a large teaching hospital. I don't know if you have visited St George's at all, but if you have, you'll know what I'm talking about. Or it's also, it's on the popular TV series 24 Hours in A&E. That's the A&E in St George's Hospital. So you really get a sense of being in university in like a practice setting. You might be standing at Pret waiting for your coffee with a patient or a doctor or a nurse behind you in the line. So you really get a sense of being in a large, vibrant teaching hospital. A high proportion of our students graduate with good degrees, so we've been really impressed with what our graduates have achieved. We've had many who have graduated with first class degrees or 2-1s. And as I've already said, your employment prospects are really excellent. So 93% of students from St George's were in work or further study within 15 months of the course. And we really have found in our final year BSc students are, applying for jobs and often have job offers before they even graduate, which is really, really good. We're also really proud of our NSS score. So that is a national student survey that the final year BSc students fill out, and it really looks at their satisfaction with the program. And you can see that on the website. We have a very high student satisfaction score. Okay, some other reasons to study at St George's. There is a smaller student cohort than at many other universities. So on average, we have about 30 students per year. And I think that is really nice in that as a lecturer, it is easy to get to know the students individually because of there being smaller numbers. And I think that the students can kind of get to know each other pretty well as well, and form quite a supportive group. If you walk around St George's, I think it's really clear how diverse the students are. And on the programme, we have very diverse students from very diverse backgrounds. So we have students who are school leavers, but we also have students who perhaps are changing professions, so they might have another degree. We have students who are carers. We have students from a range of different backgrounds, and some students who may have some additional health or learning needs. But we really see that diversity as a real strength at St George's. We have experienced teaching staff and researchers, so we have a growing team of course team, who the lecturers or the academics on the programme. And all of the teaching staff have clinical background. So we've all worked for many years as occupational therapists in practice before going on to teaching. And we all have quite different clinical backgrounds. So, they're lecturers who have specialised in mental health, others who specialised in trauma and orthopaedics or hand therapy. My background is working with children. So I think we all bring different practice experience to the teaching sessions. We also, as lecturers, need to do a teaching qualification. And I think that also helps with really getting students really actively engaged in learning. We have, I know you're not able to do a tour with this being online, but the facilities at St George's are really great. We have what we call the Art of Living Suite, which is, they are 2 rooms that are often used for OT practicals, where we have equipment and almost like a simulated environment. So there's like a simulated bathroom and some equipment like wheelchairs and equipment that occupational therapists might use in practice, so that you can practice your skills in a safe environment before you go out on placement. There's a really excellent library with computer rooms. Most of your books will be available online as ebooks and e-journals. There's a dissection room and a pathology museum. So the BSc OT program is approved by the bodies that it needs to be approved by. So it's approved by the Health and Care Professions Council and the Royal College of OT, and also the World Federation of of Occupational Therapy. You're qualified to practice when you have finished the degree, so it's a 3-year degree, and you're qualified to practice in all those different settings that I mentioned at the beginning when you have qualified. You go out on placement while you are on the programme. There are 1,000 hours of practice placement included in the programme content over the 3 years of the programme. Those are just some pictures of some OT students in the OT room, and it gives you a bit of an idea of what kind of learning typically looks like. So there's a lot of learning through doing, a lot of learning through discussion. I'm not sure what they're doing there. I think they were making a model of practice. So that was something that they had a lecture on, and now they're kind of having a discussion. And I think they were making a poster about that. It's a 3-year full-time program. So there are 3 terms of about 9 to 12 weeks in each term. There are, you'll be taught with lectures, small groups, tutorials, and we have a virtual learning environment. So you access all of your teaching resources through the online virtual learning environment that we use, which is called Canvas. And as I've said, there are 1,000 hours of practice placement in total across the 3 years. These are the modules on the programme. So it just gives you a bit of an idea of how the programme's structured. So these are the modules that you do in year 1 of the programme. The ones that are in green are interdisciplinary modules. So those are the modules that you will do with students from other programmes. And the 2 in the middle are just occupational therapy modules. So you do a module called Essentials for Allied Health Professionals, which is a really big module that you do with students from physiotherapy, radiography, healthcare science, and OT. And you do a module called Factors Influencing Professional Practice with the physio students. And then you do a module called Theories and Practice of Occupational Therapy, which is really about the core theory. And you do a research module that's really about introducing you to evidence-based practice. And then in your first year, you'll go out on 1 placement right at the end of the first year. That is a 4-week placement. Then in the second year, you do these modules named there. So those first 3 modules, Theory and Practice of Occupational Therapy, Human Occupation Across the Lifespan, and Occupations in Context, all really have a focus on occupational therapy treatment or intervention. So helping people or facilitating people to do those activities that are important to them. And that might be people with a whole range of different needs or disabilities in different contexts. Then you also do a research module in the second year, which is really helps to prepare you for doing your research project, which you'll do in the third year. And then you go on a 9-week practice placement. And then in the third year, these are the modules that you do. So you do a module called Reflection and Leadership for Occupational Therapy, Advancing Occupational Therapy Practice, and Contributing to the Evidence Base. And in that module, you do a research project where you will have a research supervisor who's one of the lecturers on the occupational therapy programme. And then you go out on 2 practice placements in the third year that are 8 weeks each. We have practice placements in a very broad range of settings within the London and Greater London area. These are just some examples of some settings that have had St George's students before. So palliative care settings, different children's services, eating disorder units, community learning disability team, acute trusts, mental health trusts. And we have had 1 student so far who's been on an international placement. And just please be aware that you do need to be able to travel to and from placement. We do look at where you live and try and minimize your commute as much as possible, but it is possible that the commute could be up to 2 hours. Hopefully, it would usually be less than that, but just to be aware that you do need to be able to travel. I'm so sorry about this very annoying pinging in the background. I've been trying to stop it and I'm just worried I'm going to end up losing the whole screen if I do that. So I'm sorry. I'm hoping it's not annoying you as much as it's distracting me. So support for students. There is a lot of support at St George's for students from all different programs. And a lot of, when you start the course, you will do an induction week before you start. And a lot of that induction week is about learning about the support that's available to you in the university. So I won't talk about it much here, other than to say that we have, you will have a personal tutor who will be one of the lecturers on the program, who's really like your first point of contact for any issues you might have, whether that's academic issues or pastoral kind of issues in your personal life that might be impacting on your studies. There's a student life centre that offers a whole range of support. We have a disability team, so we really encourage students to disclose any health or learning needs that you might have that might impact on your studies or your placements. And that's really so that we can get the support in place that you'll need. We have a disability advisor who writes what we call a summary of support needs for any adjustments that you might need, like, for example, if you have a diagnosis of dyslexia or other learning or health needs, and the adjustments that you might need to the program. And we also have a free counselling service for all students and welfare support and student union. And then there's also the program team and Study Plus. So there's academic support through the library that can support you with things like essay writing, referencing, those types of academic skills. Then just a little bit about the admissions process. So firstly, it's a UCAS application, so you apply online through UCAS, and you need to meet our academic entry requirements, and you can find all of that on the website. So you need to put what your academic qualifications are in your application. And that is all on the website. The website's at the bottom of the slide there, or you can just put BSc Occupational Therapy St George's into Google and you should easily find it. And that says what you need in terms of your GCSEs or equivalent, which is maths, English language and science at grade 4 or C. Then A-level or equivalent, whatever your equivalent for level 3 is, would be a BBB for A-levels. And there are a whole load of different qualifications that we would accept that are on the website, like access courses, degrees, foundation degrees, IBs, BTECs, and more. Then non-academic, as part of your application, you need to write a personal statement. And that really is, in that personal statement, you need to show that you are motivated to study occupational therapy. So you would write a bit about why you're a good applicant for occupational therapy, why you think you have the skills. So that might be skills that you have through school or other study or work that you might have done, that you think might transfer to occupational therapy. And if you have any sort of relevant work experience, voluntary work, or any work you have done that you think might be good work experience for occupational therapy. Then if you meet our entry requirements in your application, you'll be invited to an interview. And at St George's, we use interviews called multiple mini interviews. So those are interviews where they're on site, and there are 6 stations, and we have different interviewers. So the interviewers might be lecturers, students. We have students from the program who interview. We have OTs from practice who come in and interview, and service users. So you will go to a station, and each question you have 4 minutes to answer. And the questions are based on NHS and social care values. So it might be like a little case scenario, for example, and it's assessing those core values. So things like team working, communication, compassion, honesty, respecting people's dignity, those types of values. So it's not looking for very much knowledge about occupational therapy. Other than that, it's good to go in with an idea of what occupational therapy is and why you want to study it. But the questions are really around those core health and social care values. And then if you are successful at interview, we will make you a conditional offer. And one of the conditions of the offer is that you need to have a police and health check. So because you will be working on placement with vulnerable adults and children, you need to be fit for study and placement. So you see occupational health, and you also need to have an enhanced DBS clearance. And then just lastly to say, that's my email address, and you are really welcome to email me at any point before or after your application. Anytime. We really hope that we will see you in September. I will meet you probably at some point. If you come to an on-site interview, you'll meet me or somebody from the OT team. But if you do have any questions, or if you want to have a chat about the course or anything that doesn't come to mind today that you might think about after this virtual event, you're very welcome to email me, and I will do my best to answer on email, or I can ring you back to chat through anything. And I'm going to try and get off the screen now where I can actually see the questions, hopefully. Okay, brilliant. I'm so sorry about that. Rachel, was the pinging driving you crazy? Could you see my distraction? I keep trying to, I feel much better on this page. I feel like I'm actually, I can see somebody else, and I can see the questions. So, Marie, sorry, I don't think you are able to join us on the screen. But if there are any questions for Marie, I think she'll be able to type. So if anybody has any questions that you would like to put on the chat, anything at all, there's no stupid question. Just, I'd much rather you ask something than left us with no question. I can see Linda. I don't have science GCSE, but I have loads of work experience with vulnerable groups. Is there a way work experience can be taken into account instead of academic qualifications? I completed a health and human science access course prior to applying to St George's. That's fine, actually, Linda. If you look at the entry requirements, because access courses have a science component to them, and it's a higher level than GCSE, I don't think that will be a problem. So I would, encourage you to apply with that. I think that will be fine.
So that's Marie commenting.
Oh,
yeah.
no,
And then
sorry.
Marie, thank you. That is really helpful.
Yes, if you have an access course, that's fine, and it says that on the course entry requirement page that I had the website. So if you just if you put Occupational Therapy BSc St George's and then just click on entry requirements, you should be able to see that. But if you're not sure, apply, I would say, because we do look at each one. Sorry, I'm just trying to move this. But yeah, if you're very welcome, Linda, to email me if you want to talk about it more. But yeah, if you have an access course, then it should definitely be fine from a science perspective.
Chloe's just asking how many days a week would we be in university. I can take that one if you want. So it varies really over the 3 years, but I would say probably on average 3 days a week. But you should expect to be doing university work 5 days a week. It is a full-time course. So there's often, self-directed work that we'll give you to do. So reading and coursework and things on the days that you're not physically here. But yeah, depending on sort of the term, but I think, yeah, it's usually about average 3 days a week that you are required to be here and on site. I can see some people typing, so we'll just give it a second for more questions to come through.
It would be easier if you could just talk, wouldn't it? I think I so much prefer to see people and just to be able to chat than pinging in the background.
Yeah, and Marie, I know you're there. I'm sorry you can't speak, but if there's anything that you think would be helpful for the students to know, you could pop it in the chat as well.
Okay. So can see Rebecca, what kind of work experience? And annoyingly, I keep getting the Teams pop up right over the chat. What kind of work experience is relevant to occupational therapy? I wanted to shadow an occupational therapist, but there are limited opportunities in local hospitals. Gosh, I think there's a lot of work experience that's relevant to occupational therapy just because it is so broad. I think you could do work experience that's relevant to occupational therapy without it actually being occupational therapy. Like quite a lot of applicants have had some experience of maybe working with children or being in a school or, working with youth groups. Those skills in working with people or caring or, it might even be with your own family, like of caring for somebody else. So I think, I think it's helpful to I found it very helpful to work shadow when I was trying to figure out what I wanted to do a long time ago. And I spent time sort of job shadowing different professionals because I wasn't too sure whether I wanted to do OT or speech therapy or physiotherapy there. So it sort of made it clear to me what I wanted to do. But in terms of your application, you haven't got to have work experience with an occupational therapist. I think if you can talk about any experience that you have that's relevant, which might have been from a club or society at school, or it doesn't necessarily have to be with an occupational therapist in a hospital if that's difficult for you to arrange. But you can always approach occupational therapy teams to ask. Yeah, thanks, Rachel. Yeah. Oh, yeah, schools and nursing homes.
Yeah, like Sarah said, it doesn't have to necessarily be in an occupational therapy team with an OT, you can definitely sort of think outside the box a little bit. And, any experience that we can see where you're working with people, either in healthcare, social care, the third sector is really great.
When is the next in-person open day at St. George's? Colette, are you on this call? Are you able to answer that? We have just had one, actually. We usually have one in September, which is the main open day. I'm not aware of another in-person open day for an undergraduate open day, but if there is one, it would be on the website. So I would say if you keep an eye on the website, Colette's typing, she'll be the best person to answer this, so I'm not telling you the wrong thing. Oh, thank you, Marie. Is it all right if I read that, Marie? Because I know you would say it. Marie's our third year OT student. I'm so sorry that it's annoying when you can't talk. But Marie said, I thought I would mention my placement experiences. My first was during the first year, and this was community-based. We supported clients who were at risk of falls. This involved assessing the clients within their home environments and ordering equipment. My second year, I had 2 placements. My first was community mental health. Again, I visited clients in their home to establish client-centered goals, where at home or in the community. We then established interventions to best support their needs. During this placement, I was also fortunate enough to spend one day at Pentonville Prison, working alongside an occupational therapist and psychologist. My third placement was on a neurorehabilitation ward and involved supporting clients who had traumatic brain injuries through their rehab process. All the placements, as you can imagine, were very different. My fourth will be with a primary school, so I have been privileged enough to work in a number of settings. That's great. There's really quite varied placements, I think you can hear from that, which is, you getting that sort of broad experience before you qualify. And we organise all of those placements, so and look at you getting the experience that you need in an acute and a community setting, and also working with people with physical needs and mental health needs. I just will say that we were briefed before this that I think this call ends at 5:02. My understanding is that the call will just end. So I don't want us to get booted off. I can see people are typing just without saying thank you so much, just because it looks to me like there's only 1 minute left and I can see several people are typing. Just to say thank you very much for your time coming. If we do get booted off, there is a chat room that you can go into, and Rachel and I will go in there and keep answering questions there. And also you are so welcome to contact us if you want to, kind of nearer the time. We'll just keep going in this last minute with, so Colette said undergraduate open day will be hosted sometime next year. Yeah, so we've just recently had one, and I think it'll be a year later. Is that right, Colette? On the university website. Brilliant.
Great. Before we go, thank you, everyone.
Yeah, thanks so much for coming, and we really hope to see you in September. And do get in touch any time if you want to have a chat in person, like an actual chat where you can talk back.
Oh, I think we've